Hi, Dr. Butler here. Thank you again for taking the time out of your day to learn more about your health. What we're going to talk about today is adrenal fatigue. A lot of these topics are topics that have been spoken on. Light right there, shine that down a little bit. A lot of these topics are topics that have been spoken on by many different doctors, many different practitioners. And I feel like it's my due diligence to speak on them because they're, again, a pretty known topic within culture, within individuals' health. And adrenal fatigue is absolutely something that is relevant. But part of my opinions and my viewpoints are what I'm going to try to share with you today to help you really understand, why would you have adrenal fatigue? Why would that be a concern that you should be trying to investigate as it pertains to your health? And so the first thing to understand is what the adrenal gland is. The adrenal gland is as it states, a gland that sits right on top of the kidney. You have two kidneys in your body. You have two adrenal glands that sit on top of them. And they're right here in the back, kind of tucked in under the rib cages to protect them. And so the adrenal gland serves really a multitude of different functions within the system. The predominant one that we'll talk about today is the release of cortisol, because that really is the biggest part of adrenal gland kind of fatigue as we think of it in that sense. And most individuals kind of relate to when they're fatigued, when they're tired, when you're burnt out, when you've just kind of had it up to here and you can't really put any more gas in the tank. There's that kind of, again, I do believe that adrenal fatigue is in the garbage pail diagnosis category, much as is IBS, much as is other kind of diagnostics which are just there to label something, and that doesn't mean that there's not something that's wrong with the individual or wrong with the patient, but too often in our healthcare setting, we just throw labels at things. It's like, well, you must have adrenal fatigue, and that accounts for everything that you're dealing with. And here's a supplement, here's some herbs, take these, and hey, look, you feel better. And we want to feel better, and you deserve to feel better, but you deserve more to understand why you feel the way you do, and why do you have adrenal fatigue. And I can guarantee you it is not for the lack of ashwagandha or for the lack of rhodiola or ginseng or herbs. And I love herbs. You use herbs. They help heal your body, but they are not the driving cause behind why you are dealing with the health conditions you are dealing with. If you have adrenal fatigue, it is predominantly because your nervous system is running in a greater state of sympathetic dominance. A couple of my videos before, I've talked about how the autonomic system works. The autonomic system is a part of the nervous system that controls organ function. It controls the glandular function. It controls these different parts of the endocrine system that dictate how you feel, how you respond, how you basically manage what comes in front of you, whether it's an adversity, from a physical standpoint, from an emotional standpoint. Your body, remember, is always in this environment of where it is kind of, moving back and forth. It's like, I always have this vision of a river, and the river's moving in one direction, then it's moving in another direction. Remember, these reeds in the water just move with that river. Everything's moving with the environment. And if the environment, shifts in one direction towards a state of sympathetic dominance, fight or flight, you are starting to upregulate your adrenal gland function. You start upregulating cortisol production within the body. The thing that is oftentimes not communicated to patients and communicated to individuals who are dealing with conditions such as low thyroid, or conditions such as irritable bowel syndrome, or inflammatory conditions, fibromyalgia, is that is a source of all of this downstream reaction that is taking place, is that imbalance in that autonomic nervous system. And when you go into a state of fight or flight and that cortisol rises up, thyroid, which dominates the parasympathetic state in the body, drops. So one goes up, one goes down. The body's all, is entirely run on feedback loops, feedback systems. As this goes up, this has to come down. It has to accommodate for the change of environment. So adrenal fatigue, generally speaking, and most people can relate to this, is you're overloaded, you're stressed out, you're not getting enough sleep, you're not taking care of yourself. And at times, it's hard for people to take care of themselves. They got sick kids, they got work to do, they got to take care of their parents, they got to pay the bills, they got to fix the car. I mean, there's all these different, and I'm going to call them perceivable stressors. Now, those are facts of life. When you got a sick kid, you have to take care of your kid. Car breaks down, you have to find a way to get it fixed. And sometimes you have the money, sometimes you don't have the money. The concept that I always try to bring to my patients, that I want to try to educate you about, is remember, everything is going to be okay. The moment you go into a point of reference where you're looking at a situation that's going on and you move into a belief that things are not going to be okay, I'm not going to get that car fixed, I'm not going to be able to make it to work because my kid's homesick, I'm not going to be able to do this, you're going to start shifting into a cortisol dominant state within your body's physiology. That fight or flight state starts to dominate. The parasympathetic state starts to retract. Thyroid goes down. Cortisol goes up. Inflammation goes up. Gut permeability opens up. Your circadian rhythm gets disturbed. Your ligaments get loose. If you got any pain, any pre-existing conditions on your body, neck pain, back pain, knee pain, it's going to flare. And it is all being driven out of the shift of that nervous system. And that consequentially, over time, if you live long enough in that state, you will wear out your adrenal gland. And again, and so what do you do? Well, like I said, there's all these different types of natural therapeutics you can use. The worst thing to do, don't drink coffee. Don't drink Red Bull. Don't take stimulants to rev yourself back up. If you do that, that's a lose-lose situation. In the moment, it seems to be a win-win situation because, hey, I got energy, I can focus, I can stay on track. Even in the midst of that adversity and all my stress, I can keep going. And that is a recipe for cancer, in my opinion. If you start messing around with using a stimulant to maintain a level of output that is unsustainable, it will break down in a fairly significant way that causes a state of chronic illness, and then you got that whole ball of yarn to unravel. So the vision is that you listen to your body. You have adrenal fatigue, you're tired, you're stressed, you need to stop and start looking at what is going on in your environment around you. How are you supporting your self-care nutritionally? Exercise, sleep. Supplements are relevant. Take those herbs. Use B vitamins. Use some things to buy you some time, give you some support, give you a little bit of energy. Again, that's not per stimulant. Again, don't do stimulants. You can't do stimulants because they impact an even greater burden on the adrenal gland. So use other things that buy you time, but you have to look at the environment of what is going on around you. Take the time to do that. Surround yourself with a team of people, your doctors, your acupuncturist, chiropractor, your counselor, whomever, friends, family, that are going to help you get grounded to understand what is going on in your environment and what you need to do to change in order to move out of that sympathetic state, fight or flight, into a state of parasympathetic activity, which again, thyroid dominant, digestion dominant, anti-inflammatory. When you do that, you will heal. You will break out of the pattern of adrenal fatigue, and you will begin learning more and more what you need to do to take care of yourself, to stay in that level of self-care and I'm telling you, it'll outperform anything that you're going to find in that bottle. So again, thank you for taking the time to learn more about your health today, and we'll see you next time.